so now for the short but brief introduction of our scope and standards of MCN. So dito, ang itatakan lang muna natin is more on the general, and later on, we'll be heading to the specifics with regards to MCN sa Philippines. So first things first, how do we differentiate scope and standard? So from the word itself, I know very familiar na tayo lahat, scope is hanggang dun lang yung sinasakupan ng governing law or policy na yun. So to a certain extent lang, in which it is considered relevant. Pag sinabi naman natin standard, ito yung sinusunod ng mga professionals or practitioners that will help them accountable. So, yung standard na ito, it may reflect their values and priorities of the profession. And in terms like this, or in our discussion, it is the nursing standard. Now, what is the primary goal of MCN? So, it is the promotion and maintenance of optimal family health. So, bakit family health? Di ba maternal and child nga lang? So, bakit ang goal is to promote and maintain family health? Is because, saan ba nagsisimula ang family? Di ba? With the preconception or conception or joining of two individuals. So, let's keep in mind na ang goal talaga ng MCN is to promote and maintain family health, and hindi lang siya towards the specific of the mother and the child. So, ang maternal and child health nursing, nare-range siya mula sa bago mabuntis si mother hanggang sa menopausal stage or hindi na siya makapag-produce ng viable egg cell. So, hindi lang natatapos din dahil itatakal din natin yung health issues and healthcare providers. Kaya diba meron tayong normal OB, abnormal OB, normal child, and abnormal child. And then, now, we'll be talking the scope of practice ng nursing. So, itong i-discuss natin, examples lang siya. It does not mean na ito na lahat yon. So, pwede siyang mag-range mula sa bago mabuntis si mother, preconception, healthcare, like usage of condom ng partner, usage of depo, di ba? And then, another scope is the care of women during the 3 trimesters of pregnancy and yung per period, or yung a month or 2 after delivery of the baby. And another scope is yung care of infants during perinatal period. And we'll also be discussing the care of children mula sa birth hanggang late adolescent. Diba? Yun naman yung range na, or dun pumapasok yung care natin and in MCN. And then we also have the scope of care in a variety of hospital and home care settings. Kung mapapansin nyo dati, diba, uso, or hindi naman uso, pinapayagan yung home delivery. So, sa bahay, manganganak. Pero ngayon, bawal na siya. So, strictly, if the patient or the mother is primary, dapat sa hospital talaga siya, bawal sa lying-in. Kapag more than 5 na yung baby sa na-deliver, kailangan sa hospital setting din siya. And dito sa home care settings, dinidiscuss na natin yung kung ano yung mga dapat i-health teach kay mother during pregnancy, before pregnancy, and of course, per period. Now, we'll be talking about the specific scope of nursing in the Philippines.
Good day everyone, this is Katrina Santiago from BSN 44. So ang i-discuss ko ngayon is the Section 28 of the Philippine Nursing Act of 2002, which is the scope of nursing practice.
Okay, so our topic is the Section 28 of the Philippine Nursing Act of 2002.
2022 with the scope of nursing practice. So it is stated here that when a person initiates and provides nursing services to other people, family, and community in any healthcare setting or any healthcare environment, he or she is considered to be practicing nursing within the meaning of this act. So, dito sa slide na lang ako ng parang mga keyword natin para mas madali natin maintindihan or matandaan kung ano ba yung focus ng nursing practice. So, first is across the lifespan. So, according to Section 28, nursing care includes but not limited to conception, infancy, childhood, toddler, preschool, school age, adolescent, adulthood, and old age. So, in conclusion, yun, parang womb to tomb talaga yung eksena natin mga nurses sa mga patient natin. Next is the health promotion and sickness prevention. So, as an independent practitioner, nurses are in charge of promoting health and prevention of illness or sickness. So, ayun, one way to do this to yung patient education. So, kahit yung simpleng pagtuturo lang natin ng proper hand hygiene sa patient or sa ibang tao, it promotes health and it prevents illness in some way, lalo na ngayong pandemic, di ba? Next is the collaboration. So, nurses, as part of the healthcare team, they are responsible for collaborating with other healthcare professionals on the curative, preventive, and rehabilitative elements of care, as well as yung restoration ng health and yung alleviation ng suffering or pain ni patient. And if yung recovery is not possible, yung transition towards a peaceful death. So therefore, according to Section 28, it shall be the duty of the nurse to provide nursing care through the utilization of the nursing process. So yung ATPAI. Nursing care includes but not limited to traditional and innovative approaches. So like sinasabi, nursing is an art. So therapeutic use of self. So ito yung when the nurse makes use of his or her own personality or knowledge in order to make a change or to effect a change sa isang sick person. Next is executive care techniques and procedures, essential primary health care, comfort measures, health teachings, and administration of written prescription for treatment and internal examination during labor in the absence of antenatal bleeding and delivery. So letter B is to establish linkages with community resources and coordination with the health team. So ito yung sinasabi kanina na collaboration. So yung next part ng Section 28 ay i-report ng groupmate ko.
Hello, I am Sandra Maubat from BSN 44, and I will be continuing the discussion of Katrina about Section 28 scope of nursing. To continue, it shall be the duty of the nurse to provide health education sa mga individuals, families, and communities. Ang health education ay important role ng isang nurse dahil pinapa-improve nito ang health status ng patient to prevent illness or diseases. Next is, it shall be the duty of the nurse to teach, guide, and supervise students in nursing education programs, including dyan ang administration of nursing services sa iba't ibang settings such as hospitals or clinics. Isa yan sa duty natin para may susunod sa yapak nating mga nurse at para magkaroon pa ng nurses in the future. Duty rin natin na mag-undertake ng consultation services not only sa hospitals and sa patients natin, pero sa mga nursing students din na kailangan ng consultation since it is our duty to help others. And we must also engage sa mga activities na nagre-require ng paggamit ng knowledge and decision-making skills ng isang registered nurse. Para hindi maging stagnant yung napag-aralan natin at para mas mahasa or mas ma-sharpen ang skills natin sa field na kinabibilangan natin. Lastly, it shall be the duty of the nurse to undertake nursing and health, human resource development training and research which shall include but not limited sa development of advanced nursing practice para mas mag-improve or mas mag-widen yung knowledge na meron tayo. I-take note din natin na this section ay hindi applicable sa mga nursing students na nagpe-perform ng nursing functions under supervision. Kasama din sa section na ito na sa pagpapractice ng nursing sa lahat ng lugar, the nurse is duty-bound to observe the code of ethics para ma-uphold ang standards ng safe nursing practice. And it is also the duty of the nurse to maintain competence by continual learning sa pamamaraan ng pagpapatuloy sa professional education. This professional education should be provided by the accredited professional organization, and that the program and activity for continuing education shall be submitted to and approved by the board. That is all for Section 28 Scope of Nursing. Section 29 will be discussed by Jen and Diane. Thank you.
So I am Jennifer M. Gatchalian, and I will be discussing qualifications of nursing service administrators po. So let's start. So let's discuss Section 29, qualifications of nursing service administrators. First, a person occupying supervisory or managerial positions requiring knowledge of nursing must A. Be registered nurse in the Philippines, B. Have at least 2 years experience in general nursing service administration, and C. Of course, possess a degree of Bachelor of Science in Nursing with at least 9 units in managerial and administration courses at the graduate level, and D. Be a member of a good standing of the accredited professional organization of nursing. This will be further discussed by Ms. Diane Lim.
I'm Mary Joyce Diane Lim from BSN 44, and I'm here to discuss about the continuation of Section 29, which discusses the qualifications of nursing service administrators. Aside from the qualifications that were mentioned earlier, a chief nurse or a director of nursing service shall at least have 5 years of experience sa supervisory or managerial position in nursing. And aside from that, dapat meron silang master's degree in nursing. So next, para naman sa mga chief nurse in primary hospitals, dapat they have the maximum academic qualifications and experiences. So ito yung mga na-mention earlier. Dapat they are a registered nurse in the Philippines, have at least 2 years of experience in general nursing service administration, and lastly, dapat they possess Bachelor of Science in Nursing with at least 9 units in management and administration courses on the graduate level. Then, ang mga chief nurse natin in public health agencies who have master's degree in public health or community health nursing, sila dapat yung nabibigyan ng priority for the position. Para naman sa mga chief nurse natin sa military, ang nabibigyan dapat ng priority ay yung mga naka-finish ng master's degree in nursing and naka-complete ng general staff course or yung tinatawag natin na GSC.
So, good day to everyone. I am Andrea Faye Flores from BSN 44, and I'll be tackling ethico-moral considerations of maternal and child practice. So, as we go through maternal and child nursing, hindi na uncommon yung mga ethical dilemmas kasi diba, here involved pa rin yung mga medical decisions. So we'll tackle several ethical quandaries from specific processes or mga methods na madadaanan natin when we talk about maternal and child health. So with that being said, the first ethical issue that we'll talk about involves conception issues. So there are several methods given sa mga couples na gustong mag-conceive given that they pass certain parameters for such method kasi each methods meron siyang mga certain guidelines na kailangan mo na lang ipasa para mag-consider sila for that specific method. So the first method would be in vitro fertilization. So for sure familiar naman kayo sa term na to. So this is commonly suggested for couples na hindi kayang mag-conceive dahil may problem yung woman in terms of obstruction or may damage yung fallopian tube niya, or pwede namang yung lalaki has low sperm count. So ito yung tinatawag natin na oligospermia. Pwede rin to sa mga may absence of cervical mucus kung saan nape-prevent na yung sperm na makapasok sa cervix. And then pwede rin yung may presence ng anti-sperm antibodies which causes yung immobilization of the sperm. And also commonly suggested to sa mga couples na may long history na ng subfertility or hindi nga sila makapag-conceive. So mainly, yung ethical quandary kasi dito surrounds dun sa pinaka-roots niya sa history. So una kasi itong na-invento or na-introduce sa US before. So malaking issue siya from other countries kasi nga they attacked the procedure, presenting na nagkakaroon ng unethical experimentation sa human being or sa human life. So, ang pinaka-moral argument nila is that against dun sa fertilization ng human egg sa isang laboratory dish, is that yung desire ng parents to conceive a child does not equate or does not entitle them to use unsafe method kung saan pwedeng mag-result to sa deformed fetus. So, kumbaga, yung desire na magkaanak, hindi niya kayang i-outweigh yung possible risk na mabubuo dun sa fetus. So, in contrast to this, sa England naman, maganda yung naging response ng tao sa in vitro. So, that caused a successful live birth in IVF. So, nagtuloy-tuloy na to, nagkaroon ng greater success rates in terms of IVF. So, since nagkaroon na ng experience, nag-accumulate na yung experience dito sa technique na to, tumaas na yung way ng benefit rather than its risk doon sa fetus and sa parents. Next naman is yung embryo transfer or surrogate embryo transfer. So, common assistive technique siya for a woman na hindi kayang mag-produce ng ova. So, dito ang nangyayari, pwedeng it's a donor friend, relative, or someone from an agency na kayang mag-donate ng oocyte dun sa babae. So, ang ginagawa dito, just good to know, is that ang ginagawa is yung menstrual cycle ng donor at saka nung bibigyan ng oocyte is sinagmamatch sila yung menstrual cycle. So, ang gagawin dito, mag-a-administer sila ng gonadotropic hormones para mag-synchronize yung menstruation kung saan kapag time na ng ovulation, yung donor ovum tatanggalin through transvaginal ultrasound-guided procedure, tapos ilalagay siya, fertilize siya sa laboratory. Tapos gagamitin naman yung partner sperm ng babae. Tapos yun, saka siya itatransfer sa uterus ng woman. Tapos yun, once pregnancy occur, yun na siya, unassisted pregnancy na siya. So again, same pa rin ng mga ethical dilemmas to kasi pwedeng mag-outweigh daw yung risk sa fetus and sa parents during the process. Sa surrogate mother naman, so ito yung kapag may woman na nag-agree to carry yung pregnancy for that specific couple. So marami kong instances or maraming possible situations. So pwedeng yung surrogate yung magbibigay ng ova and then yung partner na guy yung magbibigay ng sperm. Pwede rin both the ova and the sperm are donated to them, or pwede namang donor ova and sperm and then yung mag-carry is yung woman nga na nag-agree. So, kumbaga, pwedeng family member, relative, pwedeng friend yung as long as may consent. And then, number of ethical and legal considerations dito nangyayari usually kapag yung surrogate mother is nagkaroon ng instance na na-attach siya dun sa baby at the end of the pregnancy. So, since may mga legal binds naman to and may a prior legal agreement dapat for a surrogate mother, so, ang mangyayari na dito is court decisions or jurisdiction na siya ng court. So, mamaya matatakil kasi yung mga legal concepts, pero yun, iikot na siya sa court decisions. So, another potential naman na problem dito is kapag medyo petty siya, pero kapag daw yung child na naipanganak is imperfect or hindi gusto ng parents. So, ayun, medyo mahirap na debate yun. So, next naman, yan, ito yung process na nasabi ko kanina for in vitro and for embryo transfer. Next naman na problem or conception issue is abortion or yung partial birth. So, familiar naman tayo na medical term siya for any interruption of a pregnancy before a fetus is viable. So, kapag sinabing viable fetus, diba, defined as a fetus of more than 20 to 24 weeks of gestation. So, again, this is an ethical dilemma that's very sensitive in nature. Still a big debate for it surrounds multiple grounds. Example would be, trigger warning lang, is for a patient that experienced rape. So, or may conception na nangyari during that, and kapag may unwanted pregnancy. So, debates are still in notions, especially between a more religious sector and for those advocates of pro-choice. So, dito pa rin papasok yung ethical principles natin in nursing, yung beneficence and non-maleficence. So, yun. Next naman is the fetal rights versus rights of the mother. So, dadaanan ko lang to since ma-mention din siya later on. Pero there are certain situations that puts the life of the baby and the mother in danger or at risk. And then, may certain situations na ibabalance mo yung life nila. So, kumbaga, one cannot survive while the other does. So, parang may situations na kailangan mong i-let go yung isa for the other to grow. So, if you're familiar with some TV shows like Grey's Anatomy, na parang meron doon is yung mother has cancer, and to be able to cure that cancer, she has to let go of the baby or the pregnancy, pero medyo late pregnancy. So what they did is they did not let go of the pregnancy, pero hindi na-cure yung cancer. Ayun. Just a good to know. Next naman is yung stem cell research. So yan, according to studies to, stem cells and their derivatives hold a lot of potential for future medical therapy, especially para sa mga diseases na we treat as incurable before. So with this help, pwede na daw siya ma-cure. Pero yun. So, stem cells kasi can be obtained through bone marrow, yung mga adult cells natin, embryos, or umbilical cord blood, or yung embryonic stem cells. So, after giving birth, may mga mother na willingly nagbibigay ng samples for research. So, ang ethical issue nito mostly circles around informed consent ng pagbibigay ng samples for research. Kasi nga, one source na kinukuhanan ng stem cell, na-mention ko nga, is from the embryo. So, medyo sensitive to. Unless, syempre, may informed consent. Okay, so next is resuscitation. So, familiar na rin tayo dito that this is the attempt to restart a person's breathing or heartbeat. So, pinaka-common na resuscitation effort natin is CPR. So, ang ethical issue dito mostly surrounds yung utility, withholding or withdrawing interventions, and yung mga advanced directives, yung mga dito yung directive na not to resuscitate. Then yung mga presence ng family, yung mga palliative care, and so on. So again, iikot ulit yung ethical concepts nito sa there's specifically sa concept of non-maleficence and beneficence, diba? If it gives more harm than benefits, diba? Or if increases the risk rather than the benefit. So, again, from the TV show Grey's Anatomy, diba? Sabi doon is, you continue CPR parang hanggang to the point na masasabi mo sa family ng patient na you did everything you can or you exercise all the possible resources you have to help the patient or to help their family member. Pero syempre, in reality, you also have to follow agency protocols or hospital protocols. So next naman is yung ito, from the number of procedures or degree of pain a child should be asked to endure to achieve a degree of better health. So again, papasok pa rin yung concepts of non-maleficence and beneficence. So if the risk is greater than the benefit now, diba? Why should we continue? So we're just causing more pain. But of course, with the consent of the family and with regards or with following pa rin yung mga protocols natin. Next naman is yung balance between modern technology and quality of life. So in healthcare, continues yung advancement or improvements natin sa technology. So para magkaroon ng easier methods of healthcare delivery. So example na lang is yung rise ng electronic medical records. So with its convenience comes the risk as well, especially sa client privacy and information confidentiality. So papasok din dito yung next next issue is yung difficulty maintaining confidentiality of records when there are multiple caregivers involved for each patient. So to protect the patient privacy, nagkaroon tayo or nag-establish sila ng privacy rule. So familiar kayo dito, which is HIPAA. So this stands for Health Insurance Portability Act and Accountability Act. So, kumbaga, meron dito mga national standards to protect individuals, medical records, and other health information. So, this applies sa mga health providers na nagkakandak ng mga healthcare transactions electronically. So, yung pinaka-key rule kasi dito, something to remember, is that this gives the patient the rights over their health information. Kumbaga, they have the right to examine, to obtain a copy of their health record, and to request corrections. So, syempre, patients are exposed to multiple health providers due to several days of hospitalization and to assure continuity of care. So, ito yung use ng HIPAA. So, in addition to learning these technologies and rules sa maternal and child nursing, and nurses must be able to explain their use and their advantages to clients. Otherwise, yung clients may find new technologies more frightening than helpful to them. So it is always our duty to be advocates and always for the benefit of the client. So let's move on to the next ethical principle.
Good day, I am Renzel de Guzman from BSN 44. Okay, let's start. When caring for patients, hindi imposible maka-encounter tayo ng ethical dilemmas. Those dilemmas may be easy to solve or not. Those dilemmas may come in all sizes and shapes. Mahalaga ang ethics para ma-ensure natin ang integrity ng profession natin at makapagbigay tayo ng maayos na care sa mga pasyente natin. Here's the catch. The legal and ethical aspects of issues are frequently intertwined, making decision-making in this area difficult. May mga pagkakataon na masusubok talaga tayo pagdating sa decision-making. Kasi may instances na yung ethical issues ay taliwas sa legal issues. Pero uli, hindi natin pwede balewalain ang legal aspects dahil nanggaling ito mismo at nakatalo sa ating lisensya, laws, scope of practice, at public expectation na ang practice ng mga nurses ay nasa mataas na professional standard. Halimbawa, may isang 16 weeks pregnant during the prenatal check-up. Nandoon ka kasi sa kaso nag-a-assist and bumulong sa'yo yung nanay na pwede ko ba ipa-aborto? Natameme ka kasi first time mo na makarinig ng ganon. Tapos, nagalit yung nanay kasi hindi naman daw ganap na tao yung nasa tiyan niya. So, bakit siya mag-a-adjust at kailangan ng maghirap? Tapos umiyak na siya at naawa ka sa kanya kasi naiintindihan mo yung nararamdaman niya. Hindi mo alam ang isasagot mo kasi nga naaawa ka na sa kanya at gusto mo na siyang tulungan. Pero according sa House Bill No. 13 ng Pilipinas, ang abortion ay illegal at may karapatan ang mga hindi pa na ipapanganak na bata. Kaya mahirap mag-decide kasi meron tayong sa tingin natin tama. Pero sa legal aspect, iba ang sinasabi at iba ang gusto naman iparating. Next is, since maternal and child health nursing is so strongly family-centered, it is common to encounter some situations in which the interests of one family member are in conflict with those of another, or the goals of a healthcare provider is different from the family's. Maintaining privacy, yet aiding problem solving in these instances can be difficult, but is a central nursing role, according yon kay Kim et al. 2016. Dahil family ang involved sa maternal and child nursing, hindi maiiwasan na maka-encounter tayo ng mga situation na magkakaiba tayo ng opinion. May mga pagkakataon na, for example, iba ang opinion ng nurse sa tatay, iba rin yung opinion ng nanay sa tatay. Tulad na may sakit ang 2 months old na baby ni Mr. and Mrs. X. During the health teaching, ini-explain mo yung dapat na gawin nila para matulungan ng anak nila na gumaling. However, yung tatay ayaw makinig kasi according daw sa nangyari sa kaibigan ng magulang niya na ganyan yung sakit at ginamot, ay hindi naman gumaling. Kaya ayaw niya maniwala. Pero yung nanay ng baby ay gusto makinig at willing na sundin ang tinuturo mo. Huwag ka makikipag-away kahit na hindi ka maintindihan ng kausap mo. I-maintain mo yung professionalism at huwag mo ikakalag na, ay sige dito ganyan, ayaw makinig. solve the problem in a rational way dahil mahirap. I-explain mo ng maayos hanggang sa maintindihan ka nila dahil responsibility at role natin na maging educator. The next is the Pregnant Woman's Bill of Rights and the UN Declaration of Rights of the Child provide guidelines for determining the rights of women and children with regard to maternal and child health care. Kung merong Pregnant Women's Bill of Rights and UN Declaration of the Child sa ibang bansa, meron naman sa Pilipinas na Republic Act 10354, the Responsible Parenthood and Reproductive Health Act of 2012, na isa ang maternal and child health, health of the unborn, at safe delivery and birth of healthy children sa mga guiding principles ito. At isa pa ang Presidential Decree number 603, the Child and Youth Welfare Code, na sinasabi ang bawat bata ay binibigyan ng dignidad at halaga tulad ng mga tao from the moment of conception pa lang, kahit na hindi pa siya fetus o hindi pa siya naipapanganak. Okay, so nursing ethics naman tayo. Ano nga ba ang nursing ethics? Nursing ethics is a division of ethics which deals with moral behavior of nurses in the practice of their profession. Gaya nga ng sinabi ko kanina, may pagkakataon na makaka-encounter tayo ng mga sitwasyon na matitest yung decision-making natin. Kasi may times na iba ang nasa code of ethics ng nurses sa kung ano ang pinaniniwalaan natin tama o mali. Ang nursing ethics ay isa sa tumutulong sa mga nurses kung paano sila mag-decision at mag-act sa kanilang practice o profesyon. Hindi pwedeng bahala na sa nursing. Kakailanganin natin mag-decide, kaya nga may code of ethics tayong sinusunod. Meron tayong responsibilidad sa sarili natin, sa ating profesyon, at sa ating mga pasyente. Kaya kahit mahirap, ito yung nag-represent na totoong art ang nursing at ng integridad natin bilang nurses. Let's proceed sa purposes ng Code of Ethics for Registered Nurse. Una, it is concise statement of the ethical obligation and duties of every individual who enters nursing profession. Concise. Ibig sabihin exact. Itong nilalaman ng Code of Ethics ay ang mismong dapat mong sundin at wala nang iba pa. Kapag pumasok ka ng nursing, hindi pwedeng ikaw ang gumawa ng rules mo. Kailangan mong sumunod sa Code of Ethics unless gusto mong mapahamak ang pasyente mo, sarili mo, at institusyon kung saan ka nagtatrabaho. Pangalawa, it is the profession's non-negotiable ethical standards. Ibig sabihin, ng non-negotiable, hindi ka na pwedeng tumawad. Bawat bawasan o dagdagan yung ethical standards. For example, may tinanong sa'yo yung pasyente mong kakapanganak, and kapag sinagot mo ng totoo at maayos, nasasaktan siya. Pero kapag hindi mo sinabi yung totoo, aasa naman siya. As a nurse, kahit masakit at mahirap para sa mga pasyente natin na tanggapin yung totoo, hindi mo pwede dagdagan o bawasan yung dapat nilang marinig na fact o informasyon ng pasyente mula sa'yo. Dahil karapatan niya na marinig yung totoo. At nasa Code of Ethics natin ang veracity, which is our obligation to tell the truth. Lastly, ang Code of Ethics ng nursing ay isang expression ng nursing of its understanding of its commitment to society. Ibig sabihin, na ipapakita dito sa Code of Ethics ng nursing na hindi sila matatalo dito. Kasi sila yung ipinaglalaban, karapatan nila at obligasyon ng nurses sa mismong society. So yun lang. Thank you!
Good day. So I am Julian Aquino from BSN 44. So today I will be discussing ethical principles. So next slide. And so ethical principles between the registered nurses and people. So the first one is values, customs, and spiritual beliefs held by individuals shall be respected. So syempre, sa dami ng pasyente, may iba't ibang backgrounds. They come from different backgrounds, so may iba't ibang values and beliefs nila. So we have to respect whatever values or customs that they do. So syempre, in the hospital, kapag yung patient may treatment na hindi sang-ayon dun sa beliefs niya, pwede siyang tumanggi. So we can't force the patient to have the treatment. So what we can do is we notify the physician and ask the physician what we are gonna do or the next step to take. So next is individual freedom to make rational and unconstrained decisions should be respected. So dito papasok yung informed decision ng patient. So every treatment, you have to always get the consent of the patient before doing anything. So syempre, kailangan makagawa sila ng decision na alam nila yung extent ng treatment, walang hidden procedure na mangyayari. Kailangan alam ni patient lahat na mangyayari sa kanya. And kailangan makagawa siya ng decision na uncoerced si patient. So, yun. Next is personal information acquired in the process of giving nursing care shall be held in strict confidence. So, syempre, patient privacy. So, sobrang importante nito. May legal consequences kapag nag-breach tayo ng patient confidentiality. So, dito, anything na personal information kahit man about sa health status ni patient, we have to keep it confidential and only within the healthcare team na naka-assign kay patient. So, halimbawa naman, if habang gumagawa ka ng procedure kasama si patient, so at may nasagap kang chika about personal life or kung ano man, syempre wag na natin tong i-chika pa sa mga colleagues natin kasi pwede pa siyang pagmulan ng conflict kapag nalaman ng patient or ng relative ng patient na pinag-uusapan yung personal life or anything about them. So, yan. Next. So, the registered nurses and practice. So, ang first principle or ethical principle is human life is inviolable. So, it's been inviolable, sacred. So, yung sanctity of life, mahalaga siya, syempre. So, as nurses, we take care of people, we keep them healthy, we prolong their lives. So, greatest priority on being a nurse is human life or prolonging human life or keeping our patients alive. So next is quality and excellence in the care of the patient are the goals of nursing practice. So, kaya nga tayo nag-aaral, kaya we read countless books and we go to the hospital to test our skills, to hone our skills, is para we can give quality and excellent care for the patient. So, syempre, once we are registered nurses, they expect na alam mo na talaga yung ginagawa mo, kaya ka nga kaya ganap na nurse ka na. So we always have to be sure and confident on the procedures that we will do in the hospital. Kaya mahalaga talaga na we learn everything kapag nag-duty tayo. So next is accurate documentation of actions and outcomes of delivered care is the hallmark of nursing accountability. So documentation, sa pinakamahalaga to, inaaral natin to. Isa dito yung form of documentation is nursing chart. So hindi lang siya syempre for accountability in case may mangyaring mistake Ano din siya, mahalaga siya kasi ito yung isang effective communicator ng patient status with other healthcare teams. So mas madali mong makikita kung ano na ba yung mga treatment na nalibigay kay patient, kung anong response ni patient, if effective pa sa kanyang treatment, and if may changes pa tayong kailangan gawin sa treatment ni patient. So, the physician also bases their next course of treatment dun sa ating chart or sa documentation natin. So, important yung documentation. Next. So, next is registered nurses are the advocates of the patient. So, they shall take appropriate steps to safeguard their rights and privileges. So, dito, we have to be the advocate or we have to voice out the patient's concerns or queries if ever na hindi nila yan ma-voice out by themselves. So, syempre, may mga ibang patient halimbawa na pag nag-discuss si physician ng tungkol sa sakit nila is hindi naman talaga nila nagigets agad-agad. So, minsan after pag-alis ng physician, saka sila magtatanong sa'yo, sa nurse, na kung ano ba yung diniscuss ng physician. So, ang magandang gawin natin is pwede nating i-notify din sa physician na may hindi naintindihan si patient, kung ika-clarify mo ba or ika-clarify mo ba sa nurse or si doc yung magka-clarify, yung ganun. Para we have to make sure na ma-maximize ni patient yung benefits dun and na-maximize ni patient yung benefits sa healthcare niya. Next is registered nurses are aware that their actions have professional, ethical, moral, and legal dimensions. They strive to perform their work in the best interest of all concerned. So, as registered nurses, syempre, it's a great profession. So, yung mga ginagawa natin is laging may weight yan, may consequences. So, we have to make sure na we perform our actions in a dignified way. So, in our profession, pag nagkaroon ka ng mistake, since buhay yung hawak natin dito, so, hindi lang siya moral and ethical consequences, may legal consequences din. So, to the extent na pwede kang mawala ng lisensya. So, we always have to be at our best sa work, and we always have to be confident, and we also have to know kung ano ba yung ginagawa natin within the hospital.
So good afternoon, I am Mikael Bidamakale from BSN 44 and itutuloy lang natin yung discussion sa Code of Ethics. So next is registered nurses and the co-workers. So the registered nurse is in solidarity with other members of the healthcare team in working for the patient's best interests. So in a hospital setting, it's not just us nurses ang naandun, di ba? There's the doctor, of course the therapist natin, the nutritionist, yung mga nasa laboratory natin which are the medtech and the radiologists. Lahat tayo nagtutulong-tulong in order for the patient, di ba? To have the best care possible na maibigay sa kanila. So next is the registered nurse maintain collegial and collaborative working relationship with colleagues and other healthcare providers. So paano natin ma-explain ito? Gaya ng sinasabi ko, it's not just us nurses. We also have different members of the healthcare team. And in order for us to have a collegial and collaborative working relationship sa kanila, ang pinaka i-instill natin or pinapakita natin is respect. Yun yung isa sa pinakamahalaga sa healthcare team or healthcare setting. Kasi normally in the Philippines, 'di ba, sasabihin nila ang doctor, ayan, mataas yan, and then the nurses, katulong lang tayo. Same with other healthcare professions. Pero hindi siya totoo eh. We all have our independent interventions na ginagawa, independent functions, and in order for us na ma-execute ito ng maayos, with the collaboration with others, respect yung una talaga nating pinapakita sa kanila. So next is registered nurses, society, and environment. So the preservation of life, respect for human rights, and promotion of healthy environment shall be a commitment of a registered nurse. So kung kilala niyo naman siguro yung nanay natin, 'di ba? Si Florence Nightingale, siya yung isa sa siya yung nag-ano ng environmental theory or environment theory, which in order for the patient to heal, we have to have a environment conducive for healing. Now, in this context, napakahalaga ng environment natin. Hindi lang yung internal environment ng patient. Of course, ano ba yung ilalagay natin dito? Is yung environment around yung patient natin mismo. That's why malinis. Ganon. Malinis, may ilaw. Anything that would help the patient to get better, di ba? In order to preserve its health and life. So next is the establishment of linkages with public in promoting local, national, and even international efforts to meet the social needs of the people as a contributing member of society is a noble concern of a registered nurse. So duty natin na mag-establish ng for their social needs. So local man yan, national or international. So example, kunyari tuwing dengue season or rainy season, di ba, we have our kahit yung tapat ko linis ko nga, it's also a parang project na nakakatulong sa social needs in order for us not to get the dengue. And of course, pinakamagandang example now is the pandemic, di ba? We have a nationwide, di ba, vaccination which in nurses and other healthcare providers tumutulong para lang talaga hindi tayo matamaan ng pandemic na to, ng COVID. Ayan. So next is registered nurses and the profession. So the maintenance of loyalty to the nursing profession and preservation of its integrity are ideal. So, eto tanong ko sa inyo. Nung pumasok kayo sa nursing, or ayun nga, nung nursing yung tinake nyo, ano yung una nyong inisip? Kasi, kunyari ako, di ba, ito mag-aaral ako ng nursing, magtatapos ako, papasa sa boards, and then going abroad, of course, for the cha-ching, for the money. Pero, as I went through nursing school ng first year, second year, third year, fourth year ko, ayun, na-instill sa akin talaga yung pinaka-heart of nursing, yung heart of nursing, heart of caring, in which na sobrang fulfilling kasi talaga kapag nakakatulong ka. Or kahit yung simpleng nakakapagpagaling ka kasi, ewan ko, tao yun, interaction mo sa tao siguro. Yun na nga siguro talaga yung nursing profession para sa akin Of course, syempre, ayun nga, iba yung sa inyo. Pero kaya nga tayo nag-aaral, di ba, from first year to fourth year, and even studying yung ethics na to kasi ini-instill sa atin na ano ba talaga yung nursing profession para sa inyo. So next is compliance with the bylaws and accredited professional organization, which is yung PNA or Philippine Nurses Association, and other professional organization of which the registered nurse is a member of a lofty duty. So ano ba yung PNA natin? Ayun nga, Philippine Nurses Association, in which ang pinaka-purpose nito is to promote the professional growth towards the attainment of the highest standards of nursing natin. Siyempre, specifically in the Filipino nursing setup. Ayun, para makuha natin yung highest standards, we become members of this. Siyempre, after natin graduate, makapasa ng boards, makapag-practice, make it a duty na sumali sa PNA. So next is, ito na nga, commitment to continual learning and active participation in the developing and growth of the profession are a commendable obligation. So, ito na yon. Dito na papasok yung research natin. Hindi porket nakagraduate na kayo and then nakakapagtrabaho na kayo, ginagawa niyo yung nursing practice, doon na magsa-stop yon. In order for us to become better nurses in our profession, nagre-research tayo. Kaya nga tuwing fourth year, this year kami, we have our research. Kasi, nakakatulong siya sa body of knowledge ng mismong nursing profession. For example nga, nito is yung sa evidence-based practices natin, di ba? Hindi porket gumana na siya one time, which gagamitin na siya for a long period of time. What happens is, in order for that to be used for a long time, we have to establish it na talagang it's working. And how do we establish that? And of course, it's through constant research. Kasi pabago-bago talaga siya. Hindi porket ginamit mo na matagal ang ginagamit, yung pa rin, nagbabago siya. And of course, nagbabago siya for the better. Ayun lang i-add ko. So next na tayo. Contribution of the improvement of the socio-economic condition and welfare of nurses through the appropriate legislation is a practice and a mission. So kahit papano, 'di ba? Hindi lang siya nursing profession nga. Hindi lang siya sa mismong profession, but also for the welfare of the nurses. We do this for ourselves, for the betterment of the profession and betterment of the nurses themselves talaga. So ayun na nga, I hope na natuto kayo sa discussion namin, and we hope to see you soon as registered nurses. So good luck talaga sa journey ninyo. Thank you.